Medication is an important component in numerous lives across the globe. Many home health patients become forgetful when it comes to taking their daily prescriptions. Our medical innovation was designed to prevent occasions such as these from taking place. We notice the increasing problem across the whole world of accidental overdosages and wanted to do something about it. Equally as important is patients underdosing as well. Our medical innovation is a talking pill case. Our talking pill case is needed throughout the world to make healthcare patients' lives easier and safer. As the older generations are challenged by technology and not persistent with the methods, our pill case requires no technical efforts for them. Our product is so simple it only requires the push of a button and the opening of the case. The talking pill case is set up to vocalize all 7 days of the week, along with the morning and evening of each. It simply works by pressing the button correctly assigned to the chosen day of the week so the pre-recorded message can be heard. One press of the button will signify the more medicines that need to be taken, and by pressing the button again, it will give the needed medications for the evening time. For example, if a patient was taking their medications for Monday morning, the operator would push the button one time and the speaker would read off Monday morning. And for the evening time, the person would press the button one time again and the speaker would read aloud Monday evening. The buyer will notice there are 8 buttons instead of only 7. The 8th button is designated for ownership.
One convenient aspect about our innovation is the regular pill box itself can be replaced if needed from wear. So this means the owner of the product would not have to waste money on our whole set if the pill case was the only part showing signs of wear. The prototype requires technical efforts for the person setting up the personalized speaker, but not for the user or consumer. If our innovation advanced into a real manufacturing item, we would have home health nurses to demonstrate the product to the patient and set up the speakers to whatever voice the patient desired to recall the days of the week. The home health nurse would do this by hooking up the speaker to a computer by using the attached USB cord, which is also attached to the speaker. The nurse would then have whoever the desired person is to record the day of the week in either morning or evening time with it into the speaker. The speaker can say up to 6 different playback recordings if the patient requested more than just 2 times. The patient would also have the option of what to say along with the days of the week and time, such as if a patient needed a description of the color or shape of the pill along with the time, the nurse would implement that into a speaker also.
The innovation must include a cost for the consumer. As mentioned before, the main part of the pill case that makes it specifically function is the speakers. The speakers are 300 seconds or 5-minute USB recording modules with 4 buttons. The retail price is $17.99 per speaker. Our pill case requires 2 speakers to have 7 buttons for every day of the week. The total money spent on the 2 speakers for one pill case will be a total of $35.98. The pay of the employees manufacturing our product would also have to be considered when determining the ultimate price. We would try to pay each employee at least $10 an hour, but would aim for about $12.25 an hour. The employees would not be physically building the pill box themselves, but rather supervising the 3D printer and designing the prototype. The last analysis we would have to make before the absolute price would be the price of the 3D printers and how much money it would take to print one single pill case. The ultimate predicted price would be around $120 for the talking pill case after all the considerations. The price of this is just a rough estimation and would possibly be less after putting all this into action. Our talking pill case was specifically designed to target elderly home health patients that could possibly forget to take their daily medications. Our target is also towards victims with early stages of dementia. Often when aging, mankind tends to become forgetful and inconsistent with necessary requirements in their daily lives. Although our prototype is specifically geared towards this category of people, it is not limited to only these individuals. Our main rationale for our intervention is to hopefully decline the rate of overdoses from prescription medicines. By designing this system, medication errors in the home should decrease. We also want to promote independence for the individual, and this product is a great way for them to experience this. If this invention is successful in this way, it'll greatly benefit the healthcare system.
Career possibilities are a great benefit from our product. One specific job opportunity would be to have a designated worker go out to the homes and demonstrate the pill case to the consumer. This would open up many opportunities for this advancement, but most importantly would open up new jobs. Our innovation would also require us to have employees to produce the working pill case in factories through a 3D printer. This would also create a new job opening for the public. Many healthcare workers would be affected in a positive way by our origination. We not only want to help out and make a difference with healthcare patients, but also with medical employees. One of the many healthcare workers that would be affected would be a pharmacist. These specific workers would directly reap from our work the prescription errors and money lawsuits sometimes made against them. Another group directly affected by our innovation would be the emergency room nurses and doctors. These providers would be the most profited group out of all the healthcare workers due to the decrease of mistakes made when taking medication. It would not only save the investors of the product money, but would ultimately give back time for medical personnel in the ER to try and help our patients in need. In conclusion, we hope our invention saves lives and decreases difficulties patients experience when taking their medications. We aim not only to benefit the consumers of this product, but also to make this advancement valuable to healthcare workers that will be directly involved. Our goal is to improve patient outcomes and save up to billions in hospital bills for patients and save time for healthcare workers. Thank you.